In today's video, I want to discuss inflammation yet again as it relates to food sensitivities. Let's get into today's content. So food sensitivities can be hard to identify because a lot of the food testing that is done out there is looking at immune globulins that are basically made up by the body based on what we've recently have eaten. And so the problem with that is you do a food elimination diet and those immune globulins, those IgGs, are gone after you eliminate that food for 2 weeks, 2 months. And what you do is then you adapt another diet and you do the food sensitivity test again, and guess what? Now you're sensitive to the foods you're eating currently. So becomes very challenging to figure out what foods you're actually sensitive to. We have a fantastic blood test here at MDCUSTOMRX called the KBMO Food Sensitivity Test Kit. Now it tests either 132 foods or 176 foods. This test not only tests the IgG, or the immune globulin G 1 through 4, but it also tests something called IC, immune complex. This is very important to understand that this test also identifies again, not only the IgG, but the IC, which is another identifier of the food antigen and the immune globulin connecting. C3d, or immune complex, is an indicator or a marker that the antigen, so the food antigen, and the immune globulin have made a connection, and that again, that C3d is a marker of that interaction, and the more of that C3d that we have around, the more that food or that antigen is causing inflammation in our body. So that's very important to take home and to help distinguish if we really have a food sensitivity or not. A lot of times with food sensitivity kits, they'll measure just the IgG, and what often happens is that patient will, again, do the test kit, eliminate the foods that they are sensitive to or they think they're sensitive to. They'll go out, eat a different diet, and then they'll do the food sensitivity test kit again, and then the foods that they've switched to, they're now sensitive to those. So it can be very problematic and very frustrating, of course, because what exactly are we sensitive to? Which leads us into kind of another bigger problem. If we have food sensitivities, we probably have leaky gut. So we need to address the root cause, obviously, of our leaky gut if we want to get better and resolve our symptoms. So again, getting at the root cause of food sensitivities, so of course I would eliminate the food. But more importantly, I would have that patient do basically a leaky gut test, which we also offer here at the pharmacy, where we measure Candida, see if that is in the blood. We look at Occludin, which is very similar to Zonulin, if you've heard of that protein, which helps with tight junctions. It helps to seal up the GI tract. So a patient can do, if they come back and they have food sensitivities, we encourage them to do a leaky gut panel. And if that comes back positive, then we try to find out exactly why they have leaky gut in the first place. There are a multitude of reasons why somebody might have gut permeability. I just want to go through those very quickly. NSAIDs, or ibuprofen, essentially, Aleve, naproxen. Those are all what they call non-steroidal anti-inflammatory drugs. These can diminish the integrity of your GI tract, and then again ultimately lead you into having food sensitivities and a lot of other gut permeability symptoms as well. Other issues for gut permeability besides NSAIDs are my wonderful medications of antacids. So if you're on antacids, I would encourage you to look and perform the test, the gut permeability test. Oftentimes when we're on antacids, we get disruption of pH, of course, which, don't get me wrong, if we have a GI ulcer, some type of stomach bleed, we need to reduce the stomach acid so that we can heal the GI tract. but it doesn't mean we need to be on those antacids, generally speaking, for years on end. Again, I want you to work with your provider. If you're a particular patient that is suffering from leaky gut syndrome and you're on these antacids long term, hopefully you can find an alternative to those types of medications. Other issues, I should say, problems that can cause leaky gut are antibiotics, steroid use. So again, there's a lot of different other medications out there that can be problematic. One particular product that I love to use if a patient does have food sensitivities and or gut permeability is something called GluteShield. And this video is not sponsored by the makers of GluteShield, but I just want to take a brief moment and go through the ingredients that are in this particular product. I do find them to be very beneficial for many patients. As always, before starting any type of supplementation, I want you to talk to your provider or get a consult with one of the pharmacists here at our store. So let's get into the specifics of GluteShield. So the first ingredient is something called L-glutamine. L-glutamine is an amino acid, and essentially the way I explain L-glutamine is that it is the fuel that the enterocytes or the stomach lining and the GI tract essentially use as fuel to repair themselves. So L-glutamine, amino acid, it's a very basic ingredient, but it can do a lot of good to help restore the GI tract. The second ingredient in this product that I like is something called DGL, or deglycerized licorice root. Licorice root, being deglycerized, will not give patients an issue with raising their blood pressure, typically speaking. So again, DGL, it helps to soothe out the mucosal layer. The third ingredient that is in this product is zinc, and the way I think of zinc, it's this is oversimplifying it here, but it's a biological glue, and again, it helps to heal proteins and put proteins back together effectively. The fourth ingredient is aloe vera, and I'm sure we all know of aloe vera. It's what we put on our sunburns. I put gallons of this stuff on myself when I was a kid. Anyways, so aloe vera, if you think of it that way, it soothes soft tissue. It helps to kind of get that burn away essentially, and it helps to repair the mucosal lining of the GI tract. And the fifth ingredient that I really like in this product is called N-acetylglucosamine. I'm sure we've all heard of glucosamine before for joint tissue and joint pain, but when it's acetylated, what this glucosamine does, it's a precursor to mucin. And what is mucin? Mucin is that film, again, in our GI tract that gives us that protective barrier. So again, long story short, GluteShield, talk to your provider. This might be something very beneficial for you to try to help improve your leaky gut or gut permeability issue. Food sensitivities can be very hard to diagnose without doing a test, a blood test essentially, which is what we offer here at the pharmacy. But if you're a patient that, again, is suffering with inflammation, chronic inflammation, if you're suffering with joint pain, anxiety, depression, if you have chronic skin issues, skin inflammation, eczema, psoriasis, if you have issues for autoimmune disease, these could all potentially be related back to food sensitivities, which that in turn could be related back to leaky gut or gut permeability. So if you are having symptoms that, again, you can't pinpoint what is causing them, and if you haven't looked at food sensitivities and gut permeability, again, I would encourage you to call the pharmacy, and we'd be able to work with you and your provider on finding out what the culprit is and then finding a solution to that particular problem. Thank you for tuning in. If you found value in today's content, as always, I encourage you to give this video a thumbs up and share it with a loved one. In next week's video, I will be talking more about dysbiosis and gut permeability and different, we'll call it supplement protocols to restore natural GI tract. Thank you for tuning in, and